Hey everyone, thank you for joining our webinar today. My name is Andrew Townsend. I'm marketing operations here at Smarty. Today's webinar is about Project USA, and we're excited to get started and dive into this. However, before I introduce our presenter, let's go over the basic housekeeping items. Yes, this webinar will be recorded. We're going to send a copy of it out to everyone who registered, even if you've attended. So if you have to step out early or if you'd like to review this content later, I will be emailing that out to you later today. So be checking your inbox. You'll also be able to forward that recording on to anybody that needs to see it and or anyone that you think may benefit from this. So please do forward that on as you see fit. Second, to interact with our presenter and other audience members, ask questions and make sure that you're getting the most out of this webinar. We want you to benefit from it as much as possible. Do use the Q&A panel or the chat panel as part of the Zoom webinar interface. And I'll be watching those and we'll bring questions up for our presenter. Speaking of our presenter, today we have Wes Arnold, the team lead over our product marketing team. We're really excited to hear what you have to share with us, Wes. So without further ado, Wes Arnold.
Great. Thank you, Andrew. I'm really excited to talk to you guys about Project USA. I know we actually kind of misnamed the webinar because we said, what is Smarty doing or doing to prepare for Project USA? But the good news is that Project USA is now available as a format from Smarty. So we'll get into that a little bit later on in the webinar. So let's jump into what is Project USA. And I know there's probably a few of you that are attending there thinking, I already know what it is, but we actually did a survey before the webinar, and there was a good number of people who wanted to know more about it. So we'll cover it. I won't spend too much time on it, but Project USA essentially is an initiative to establish a standard approach for representing patient addresses across all health IT systems. So no matter where you're going in health IT, your record will be identified with the proper address. And Project USA is headed up by the Office of the National Coordinator for Health Information Technology in collaboration with HSC, the Health Standards Collaborative, and AHIMA, American Health Information Management Association. Now, Project USA was in a draft version for quite a long time, and then the final version, 1.0, was released on January 7th of 2022. And we want to point out that while it's not really required, it's highly encouraged. And the reason why it's highly encouraged is because the goal is increased patient matching. And we're going to talk about patient matching for a little bit as far as what does that actually mean and why is it so important. Patient matching is the linking of one patient's data within and across health systems. At a minimum, that's accomplished by linking multiple demographic data fields such as name, birth date, phone number, and address. And there's actually quite a few more that they suggest, but those are just the minimum ones right there. Now, patient matching is super important. It's becoming more and more important as populations are growing and the collection of address data or patient data in general is becoming more automated. You don't really get a chance to meet patients. And so you don't really know who they're going to be when they walk in the door. And patient matching has some really big impacts on patients. And I would dare say on the provider as well, because of some of the risks. And I've pulled a few examples from patientidnow.org that kind of illustrate the gravity of some of these situations. So this first one, multiple first and last names. So this one was a hospital registration training. The trainer was actually trying to communicate to the trainee the importance of correctly identifying patients. And she explained that in her metropolitan area, there was a person with the same first and last name. There were 5 other people in that same metropolitan area that share her first and last name. But there was one individual that shared her date of birth, just the month and day, not necessarily the year, but also shared her spouse's name, their exact wedding date, and her physical characteristics. So her height, weight, hair and eye color. And so you can see in that instance, the address data might be the only thing that is really the unique factor that helps them identify which patient that is. And then the second one, misfiled mammography results. if I can say mammography correctly. But there was a woman who went in, received a mammogram. She returned to her provider a year later and expressed, that she was happy that they hadn't found anything, because obviously they hadn't sent anything. So that's, she assumed that was why they hadn't sent anything, because nothing was found. But unfortunately, her results were misfiled in the chart of a deceased patient of the same name. And so when they actually got around to sending out the results a year later, it turns out she had cancer. And of course, you can imagine the repercussions for that. This last one is kind of crazy too. I think this is the craziest of the examples. There, in the same zip code, there was an Annie B. Smith and an Ann B. Smith who had the same date of birth, and their records were overlaid. And when we say overlaid, that just means that additional information was overwritten on their records. And Annie B. Smith gave birth to a healthy baby boy on July 23rd. And what would normally be like a time for celebration and excitement turned into chaos because Child Protective Services came and took the baby from her. And the reason was because the day before, on July 22nd, Ann B. Smith was seen in the ER for a cocaine overdose. And so they were trying to sort that out. And the baby wasn't returned to Annie B. Smith for 3 weeks. And you can imagine what happened. The facility actually suffered a multi-million-dollar lawsuit because of that. And so, like I said, these are some of these are kind of heavy, but they do show that patient matching has real impacts on the patients and, like I said, the provider.
What's unique about this, that I find unique and interesting about this, is we did a webinar about a year ago with John Marco, our legal counsel, and we talked about how addresses by themselves are not PII. They're not personal identifiable information, right? But with USAT joining this with additional information like names, date of births, and other information that you typically have in a medical record, it does become PII, which is interesting. And it's historically been like the only PII that people are like, close enough.
Yeah, and because it is such sensitive information, and like we illustrated with these examples, getting it right is crucial, right? Like being able to know that that is the exact person you're supposed to be treating and talking to, it's paramount. So here on this slide, we have some benefits of patient matching. And so doing patient matching correctly helps reduce duplicate health records, unnecessary lab testing and or care. The list goes on: incomplete records, wrong prescriptions, unauthorized access to information, and costs for unnecessary care. So when we're talking about Project USA, it's a set of standards, but what about the USPS standards? They have their own standards. So why is it necessary for something additional? And it's true, actually, Project USA is built on USPS's publication 28, but they've augmented that to help facilitate patient matching. Like I said, patient matching is the end goal. So they're taking USPS's publication 28 and they're making a few changes, a few tweaks to make it easier to patient match. So what is different? You can see on the left-hand side, we've got a USPS format. On the right-hand side, Project USA format. And you'll notice right away that the Project USA format is all capital, right? Everything's capitalized, makes it simple, makes it a little bit easier to read. And there's no explaining, well, for street, you got to capitalize S, but not the T, and just makes everything a little bit more simple. You'll also see in the third example there where highway on the left is capital H and then lowercase WY. On the right-hand side, it's just spelled out. And it makes it a little bit more simple. Same with country road, interstate. Instead of having to explain I-55 or, how do I actually put down interstate 55? Just spell it out. It makes it a little bit more simple.
So for the USPS format, I don't remember the exact number, but we found that there's over 200 approved abbreviations for different things.
Right.
So by spelling them out, you're making it very clear, no confusion.
Yeah. One of the things I should point out is that Project USA, as we go to this next slide, Project USA is not just about technology. That's a portion, but but it's technology plus personnel. So training personnel to recognize that address data, knowing how to collect address data, possibly asking for a temporary address when somebody says, well, I've moved. So part of it's technology, but part of it is training those people, your people, to really facilitate patient matching. And so I've listed this here, these complete technical specifications. And essentially, like Andrew was saying, there are so many different accepted formats with USPS. This technical specification document basically shows the mapping between the USPS standards and the Project USA standards. So after this webinar, I'm actually going to send an email with all the resources that we talk about in this webinar, so that you can have it right on hand, you can review them. But this one is very important more for the IT folks, as far as setting it up and knowing what needs to match. And essentially with our solution, just our solution, we've done this with it. But it's good to know, good to review. So also, I'll set up a HEMA companion guide, and this guide is essentially how you're training individuals and your personnel to make sure that the address data is coming in correct.
Previous one, technical one, I just next one, correct.
Yes, typical and then people. So it will be really smart as far as Project USA. Maybe instead of what smart data is, how to use address data intelligence. So that means collects or store or otherwise such address information anyway. So Smarty can help. And I built the Subject USA solution or have a street address API. And there's huge time change to these, so they can still do really our streets USP API. It's a really simple piece of basically manage it's the standard format the same and that's our API will start out starting the results in the format of the address. Now, not to mention the presidential list to define and I'm not going to get too deep into the because it all depends on previously what your needs are. Your accounting is really happy to help you take a look at this and we're going to talk to you about what is it going to mean.
This slide is if you say it's 80 and every 80 and every you should spend it.
Yeah. So arguments are should avoid. So talking about Smarty does, which I mentioned Smarty key, and here putting after patient identifier and Smarty identifier. The reason why I put that is we're not really going to talk about national patient identifier. I know it's a little bit of a hot topic. It's maybe politically charged. Sorry there today. So it does help illustrate what Smarty key is. So national patient identifier, here is that you have this identifier that follows you across all state lines, all through providers, and they'll know exactly who you are, no matter what. Smarty Key operates the same way, but it operates that way with addresses. So it's a persistent, unique identifier that remains the same, even if the address component has changed. So here near our headquarters in Provo, Utah, we have a street called, it used to be called Bulldog Boulevard, and now it's Cougar. I don't know if it's Cougar Avenue or Cougar Boulevard.
I don't remember, but there was a third one, name for the same one. I don't remember what it was.
So if you lived here 20 years ago, 15 years ago, and you remember that Provo High School was on that street, and that's why they called it Provo or Bulldog Boulevard, because of Provo Bulldogs. Provo High School moved, and so they built a new school. It moved. And that same street leads to Brigham Young University with the Cougar, so the street name changed. Essentially, that's what an alias address is. So no matter what happens to the name or maybe the zip code of that street, because it has a persistent, unique identifier, you'll always know it's the same address. And what that does is that helps you identify duplicate addresses, helps you identify those alias addresses that we just talked about, and also makes blending address data from different sources much easier, because you can just basically run it through Smarty. We'll assign the Smarty key to it, and then you can see, oh, these actually have the same number, even though maybe the spelling is different or the name is different, we know with a surety that that is the same address.
Just for clarification, I do want to point out, it's not necessarily that we assign a Smarty key when it's run through. The Smarty keys are already in existence. We're just appending that data.
That's correct.
We don't generate a new one every time.
Right. Yeah, it stays the same. So again, yeah, you'll know that address, no matter what changes with it, you'll know it's the same address. Now, why should I use Smarty? Smarty has one of the things that we see over and over again in our G2 reviews. We have dozens and dozens of G2 reviews. The major theme that we see in those reviews is that we're the easiest to use. Even before I got to Smarty, I was talking to some developer friends and talking to them about the prospect of working for Smarty. And the first thing they checked out was their documentation. And that was their first comment was, oh, wow, they have really great documentation. So I thought it was funny that was their first thing about, you should work there because their documentation is great. We also have multiple SDKs, so pre-built SDKs to make implementing our APIs a lot easier. We have a stellar support team. One of the things I love about our support team is that whenever you reach out to them, not only are they timely, but you're also going to talk to an expert because they're all knowledgeable. And another thing is, if they don't know the answer, they have a direct line to our developers so they can resolve the problem quickly.
I do want to go back to the SDKs really quick. We're talking about Project USA, and I'm not sure how many people on the call are actual developers. An SDK is a kit that essentially is a block of code that you can plug into whatever coding language that you're using. So you don't have to manually code nearly what other APIs would require you to do.
Correct. Yeah. Software developer kit is what they are. And they're essentially like a template for plugging in the code. Makes it a lot easier. Just know that your developers will be happy if we have an SDK for the language that they're using. Now, Smarty is extremely fast. We can handle processing eMPIs daily without breaking a sweat. Maybe not even raising our heartbeat, right? So it is extremely fast. We've always prided ourselves on being able to process your records super quickly. I do know that somebody on the pre-webinar questionnaire wanted to know about security, and that's a valid question because security is very important. So one of the things that we also are proud of is that we're SOC 2 compliant. And if you're not familiar with SOC 2, what they do is they essentially send out a team that comes to Smarty and they do these audits that are very in depth. They'll take random people and they'll check, what do your passwords look like as far as length and difficulty. Are you treating everything in a secure manner? And it's pretty rigorous, and we pass every year. And if you need SOC 2 compliance, we've got that for you. And then also Smarty Key, we talked about earlier, that persistent unique identifier that helps you blend data from different sources. And that's going to be very important for those of you who are bringing address data from different providers or different sources. Makes it extremely easy. Now, if you want to learn more about Project USA, I think the best way to learn more about this is to talk to an account executive. They can help you identify what your needs are and what pricing would look like for your specific needs. So use this link, and this link will take you to a form. If you don't know who your AE is, we'll figure it out for you, and we'll put you in touch with the right person. So with that, are there questions?
I have a question for our audience. I would love to see in the chat or in the Q&A section if you guys could tell me your relationship to Project USA. Are you developers that are worried about this? Are you hospital administrators that are considering changes in policy and things that you're going to be changing? I'm curious about how this is impacting you, and what drove you to come to this webinar. That's the first question. The second thing is that after this webinar ends, you will get a survey that'll pop up on your screen. And the very last question is, would you like to be contacted by an account executive to talk about your needs and such? So if you don't have the time to go to smarty.com/contact, you can always just check yes in that survey and someone will reach out to you. A comment, Wes, came up a little while ago. Someone did the research. Cougar Boulevard was originally, so Cougar Boulevard, Bulldog Boulevard, 1230 North.
Not nearly as exciting.
So yeah, that was those
Again,
were the good days.
there's 3 different aliases. So if you have Smarty Key, you'll know that 1230 North is the same as Bulldog or Cougar Boulevard.
Excellent. So we talked about the things that need to be done to our API parameters when we're hooking it up for Project USA. Is it possible to get this through the bulk tool, just through the web interface?
I do know that you can use our we do have a demo on our website of the API, but I don't know about the bulk tool.
Okay.
I'll have to check on that.
Or CLI.
Yeah.
It is relatively new. I don't remember when Project USA was announced or when we launched, but for us, I know that it's relatively new and we're still rolling out more and more capabilities.
Yeah, correct. And we're investigating other uses as far as or other solutions that might help in collecting patient address data in the Project USA format, so that not only are you cleaning the data as it's in your database, but perhaps we could prevent that from even making it into your database at all.
Sure. Okay, great. No one wanted to tell me why they like Project USA or why they care about it. So I guess we'll just assume that they had to be here and that's why they came. It was required. And
they came here because they knew you were going to be here.
Oh, that's it. They don't come for me. Nobody comes to these for me. Okay, great. Well, then we'll just close it out. Thanks everybody for joining us. Again, go to smarty.com/contact or just check the box in the follow-up survey. Thanks for coming. We hope you guys got what you wanted out of this webinar. We'll see you guys next time.